Good morning, everyone. This is Michelle Hughes from Ageless and Timeless. I have a wonderful guest today. I know I always say that, but I always have great guests. But her name is Dr. Betsy Greenleaf, and she is, well, she has a very interesting story, but we're going to let her tell it. But she is the first female certified urogynecologist in the country. So, swallow all that. Betsy, good morning. How are you?
So excited to be here, Michelle. Thank you. I'm so grateful to be talking with you today.
Well, we have a wonderful mutual friend in Susan Fox, and Susan is an incredible acupuncturist here in the Bay Area in Mill Valley next door to me, and I live in Tiburon. So I met her, and we've been brainstorming with mutual connections, and she'll probably come on the podcast sometime in 2026. We're booked solid, Betsy. We got you in, but we're booked solid for the whole year. So congratulations for being one of our guests in 2025. So, Betsy, tell us, how do you become a urogynecologist? What is it, and how do you end up being the first woman to get certified?
Yeah, it's funny because I starting back even in gynecology, I never thought that that's what I was going to look at all day long. And I remember back in residency, I had a friend who was a podiatrist and we were eating lunch and she was like, looks at me and I'm looking at her and I'm going, how do you look at people's nasty feet all day long? And I thought she was going to choke on her sandwich because she's like, do you realize what you're looking at all day long? And I'm like, oh, I didn't realize it. So, interesting enough, I actually started off in general surgery and then really was attracted to women's health care and switched over to obstetrics and gynecology and didn't even know that urogynecology was even a thing. And I know a lot of people are like, what in the world is that? And when I told my mom I was going to do 2 more years of urogynecology on top of obstetrics and gynecology, she thought it was like European gynecology, like Euro Disney, like it was some kind of fancy
Right.
gynecology. And it actually has to do like a combination of two professions of urology, having to deal with the bladder and the urinary system, and gynecology, having to deal with the pelvic organs. And there's only 1,500 urogynecologists in the United States. And so it's a specialty training beyond just even you either enter it through having training in obstetrics and gynecology or you enter it from urology. So, and it's a much needed specialty, especially when we look at conditions like prolapse, which is where things start drooping and dropping down there like they do everywhere in our body as we age. But 50% of women will experience a pelvic prolapse at some point in their lives. So we need a
Wow.
lot more urogynecologists out there addressing these issues.
Does that 50% number mostly due to aging, or are there other reasons why prolapse occurs so frequently?
Yeah, so it happens for a number of reasons. And some people are like, what you might be thinking right now, like, what in the world is a prolapse? Well, what happens is there's ligaments that hold our organs in our body. And so like our bladder's being held up by ligaments and it's kind of leaning on the vagina is being held up, the rectum's being held up, and they're so close together, they kind of all those organs lean on each other. And as age can definitely affect the tissue, but the most common reason women have that is pregnancy and childbirth. That's a lot of stressors on the pelvis, and our pelvis is just basically an open hole to gravity. So once those ligaments get damaged, there's not a lot that they can, hold them up. So things kind of just start drooping and dropping and coming down. But in women who have not had a pregnancy or childbirth, things like constipation can affect this. Smoking, we know smoking affects all of our ligaments. And certain medical conditions like autoimmune diseases can affect this too. But the youngest person I've ever seen that's had problems with a prolapse was actually a 13-year-old. She was a gymnast, and from the actual impact of, landing as a gymnast all the time, that actually affected things too. So sometimes we see that if people are doing extreme lifting or anything that's going to put a lot of pressure on their pelvis, we can see that affect their ligaments.
And so, how do you fix that, Betsy?
Yeah, that is the key. And this is why you may have heard a vaginal mesh because that was a big thing that happened in like 2012 where there's not a lot of great ways to fix this. So some of it can be doing your Kegel exercises and strengthening your pelvic floor, because sometimes the prolapse can look worse than it is because our muscles have gotten weak. And what ends up happening is we start losing about 8% of our muscle mass for every decade that we live after the age of 30. So people always think about exercising their arms and their legs, but they don't think about exercising down there. So having strong muscles can sometimes help keep things in place better, or can help with if somebody ends up having to have surgery. But even then, like once those ligaments are torn, there's not a lot that we can do. There's different things that we can do to affect the appearance, from the Kegel exercises to things like vaginal rejuvenation with lasers or radio frequency, things that will tighten up the tissue. But even surgery, which we've learned because of all the problems that happened with vaginal mesh, and the reason why mesh was being used in the first place is because even when you go in to do surgery, it's not like, well, like just fix those ligaments, because a lot of times those ligaments are so thin or so torn, there's really nothing to sew them to. So they started using materials like mesh to kind of reinforce the tissue, but they realized, hernia meshes have been used since the 1980s, and great when you're putting in the abdomen for the hernia, but when you put it in the vagina, it's a whole different area. And the vagina has to be able to have some movement. And so these meshes didn't work in that area. So they're still using somewhat materials like mesh or natural materials to reinforce that tissue. But we also know that having surgery for these kind of problems isn't like a permanent thing. It's not like, well, when you have your appendix taken out because there's an issue, you don't typically grow an appendix back. It's out and it's done.
Right.
When we're doing these types of surgeries for the prolapse, we hope to get 5 to 10 years out of the surgery, because there's just so much pressure and gravity affecting that area. So we've unfortunately learned that there's nothing permanent when it comes to treating these areas. And some people, surgery is an option, but if somebody doesn't want to have surgery, or if they are looking for something less invasive, there's also little devices called pessaries that can be worn in the vagina. And a lot of times they come in all kinds of crazy shapes and sizes, but a lot of times they look like little frisbees, and they kind of fold up and they insert and just wedge in place and hold things in place. So that's also another non-surgical option.
So is a pessary kind of like an IUD that you take it in and out when, I mean, obviously the IUD is for birth control, but is that what happens with the pessary? You would put it in before your day begins and then take it out in the evening?
Yeah, some people, well, so they're usually typically made out of silicone, and they can easily come in and out. Some people don't have the dexterity to take them in and out on their own, though the more you take it in and out and clean it, the better, because what happens is the vagina, anything that's in the vagina that's not supposed to be there, the body tries to get rid of it and will try to flush it out. So the longer one stays in, somebody might start making like a heavier discharge with that. And that can sometimes be uncomfortable, but they're typically left in as long as 3 months, where people can come into the office every 3 months and have them changed. But I always recommend that they try to come in a little bit sooner. But there's been no great studies on how long is the longest you can actually leave them in. I have to say the worst case scenario I ever saw was somebody who left it in for a year. She was a patient of another practice, and she showed up to my practice and was like, "Oh, I forgot this was there." And in one case I had somebody who was fine. We took it out, we cleaned it, and she went back to her normal activities. Another lady that came in a year later where that happened, her tissue started to grow around it. And so and she was not somebody that was healthy enough to have surgery. So we basically left it as almost like an implant. So
I mean, I'm going to ask a kind of intimate question, but if you're having, sexual intercourse, isn't it going to get very grubby and dirty with I mean, I'm being just really honest, just thinking
yeah.
from a pragmatic standpoint. So, I mean, wouldn't it be better just to be using these things more like an apparatus that you take in and out and clean, of course, and when
Yeah.
And well, I'm just, is that what you would do if it was?
Ideally, that would be the better way, but some people, when it comes to sexual relations, some people leave them in place when they're having sex, and
Yeah,
their partners sometimes feel it or don't.
yeah.
And yeah, ideally, some people just take them out completely during intercourse. But yeah, ideally, the more you can take it in and out and clean it, the better.
Yeah.
So.
Are you ready to transform your health and wellness? Join us April 25th to 27th in Dallas, Texas, at the Hilton Granite Park for the 2025 Changing Life and Destiny Conference, the event of the year for those passionate about moving our healthcare system to a preventative and proactive model. Explore 40-plus masterclasses and discover 100 cutting-edge health technologies that are shaping the future of wellness. Learn from renowned experts like Dr. Fab Mancini, Dr. Dan Pompa, and Dr. Sandra Rose Michael, and take home powerful strategies to enhance your life and practice. Whether you're looking to boost your health, explore the latest in functional medicine, or connect with like-minded individuals, this event has something for everyone.
Yeah, yeah.
But it's called a pessary.
Pessary.
P-E-S-A-R-Y. Pessary.
P-E-S-S-A-R-Y.
R-A-R-Y. And where do you get?
Usually you have to be fitted for them at your gynecologist. And like I said, they come in all kinds of crazy shapes and sizes. Typically, the standard one looks like a frisbee. It's usually like a little disc that folds up in half and kind of slides in there and then opens and wedges. But they can be as extreme as looking like a cube for like very extreme prolapses, and typically the larger and kind of crazier shapes are a little bit harder to get in and out on your own, and that's usually managed by a gynecologist.
So you said it's made of silicone, but isn't silicone dangerous to the body? I mean, isn't that what happened with women who had silicone breast implants, that they had to have them removed because of the issues of the material of silicone?
And I, being in the health and wellness and integrative medicine world, I get kind of crazy about what things are made out of. However, these devices, and we kind of say silicone, I don't know exactly what it is. They are like BPA free, but are there like a perfect healthy version that doesn't have toxins in it? I don't know if there's one that exists. I'm always asking about that. And the issues with the breast implants, that was actually, and that can be argued back both ways. I have my own personal opinions about it, but and I've seen my own cases of breast implant illness, but from a clinical research standpoint, all the studies that have been done on breast implants actually, and like I said, I don't 100% agree with it, but say that they're actually, the material is safe. But that's from a traditional research standpoint, which, like I said, I don't personally agree with all that.
Started out in allopathic medicine, so that very often there's a little poetic license in how these things are described as, quote, safe. So I mean, I don't know. I'm not an expert. I never had any, thank God. But I do know a lot of women who had problems with and had to have them removed because of the material. So anyway, what part of your practice would you say is the most challenging?
Like right now, what I'm focusing mainly is on menopause treatment. And I think that really, I mean, menopause has been around forever, but it's all of a sudden become this really popular conversation. And I don't know why. It's good because I'm glad that we're talking about it more, because it needs to be talked about. But where I find it frustrating is now you like basically open up your phone, social media, the internet, and everywhere you go, there's somebody that's talking about menopause. And I don't think they're necessarily coming about it in the right way. And what I find the most frustrating is I'm seeing women who are getting overdosed on hormones, like left and right from other places, thinking that hormones are like the panacea for all the issues in menopause, where I always teach, doctors and nurses and my patients that hormones are a tool in our toolbox, but they're not the end all be all answer to everything, and that we have to still look at lifestyle. We have to look at where inflammation is creeping into our lives, whether it's from inflammatory diets or things we're putting on our skin, and that these are things that could be affecting our hormones, and then just giving more hormones isn't going to necessarily fix those problems. So I think it becomes very, very frustrating. In addition, we have our traditional medical organizations that are still too scared to talk about hormones to women, because in 2001, the Women's Health Initiative study came out, where like a day before that study came out, they were like, hormones for everybody, kind of like the Oprah meme when you're like, she's like, a car for you, a car for you. They were like, hormones for you and you and you.
Right.
And then the next day, it was like, everybody needs to get off their hormones because it causes heart disease and breast cancer. And what we know today in 2025 is that that's not necessarily true. And the problem was not the hormones, it was the type of hormones in those studies. So
Right.
what people don't realize is that not all hormones are created equally. And unfortunately, a lot of the stuff that your insurance covers
Mm-hmm.
is incredibly toxic.
Mm-hmm.
And I actually think it should be a crime against women that those products are still on the market.
Mm-hmm.
And then we have to take a step back and go, well, why in the world are those products even on the market? And it's really purely a business decision, because in medicine, you can't patent things that are naturally occurring. So our natural hormones that are in our body are not patentable. So as a business, there's no money in selling natural hormones because they can't patent it and protect their companies. But what they can do is take a naturally occurring hormone, tweak that molecule, means like add something onto that molecule, change the shape of that molecule, and then they test it and see like, oh, it kind of works like human hormones, and now they can patent it and sell it to women. And that's what's in our birth control, and that's what's in a lot of the prescription based hormones. And we know that the Women's Health Initiative study that showed an increased risk of heart disease and breast cancer, they were using these non-natural hormones, which we now know are very incredibly inflammatory and are actually processed down a toxic pathway in the body that can actually increase the risk of cancer and heart disease. And that natural hormones in balance, we don't see those things. However, we're never going to have any big giant natural hormone studies because there's no money in it. So it becomes
Right.
this crazy circle. So
Well, but if you're using compounding pharmacies, and I know they do not have the same kind of money as the pharmaceutical industry, so of course you're right. There's just not, and there is not going to be the kind of financial ROI that you get when you're dealing with chemicals and patentable, like you said. So I agree with you. But who would ever want to put, if you have a choice, horse's urine into your body, which is what Premarin is, and
yeah.
that's what was being used for that study, right? That
Yeah.
back in 2001, and there was no such thing as compounding hormones until after that study. So it seemed like that was kind of a wake up call for a lot of these more natural, like using yams as an example for hormonal, which is more natural to the body. So how do you educate your clients, your patients, between using the traditional allopathic, pharmaceutical approach versus the compounding approach?
Yeah, so it's really more about trying to find the sources of the natural hormones. And in fact, there actually are some prescription natural products on the market, but people don't really know about them. But I also like the compounding because you can kind of tweak the doses. Because I have also found that some of the doses that we see that are on the market that are prescription based tend to be a little bit higher. But more so even in that study was the progesterone was more of an issue. The synthetic progesterones are probably the main cause of all the issues in that study than the natural. And so that's actually where I tell people to take a look. If they're getting prescribed progesterone, they want to make sure they're getting prescribed something called micronized progesterone, because micronized progesterone is the natural version of progesterone. It usually goes under the brand name of Prometrium. It gets confusing because there's a medroxyprogesterone is what we see is the synthetic version, the non-natural version that is incredibly inflammatory. It is usually associated with a lot of the side effects that people think of with progesterone, like moodiness and weight gain that happens in birth control, because unfortunately we don't have any natural hormone birth controls that are out there. We do have the option for natural hormone therapies, but not for birth control. So a lot of the things that people see as side effects are usually coming from these synthetic ones. So it's usually, looking what you're getting, because that's one you can get as a prescription from your doctor, and maybe might be covered by insurance. It doesn't always. Yeah.
The great irony of what you just said is that progesterone is supposed to make you feel less moody, and if you're using the right form of
yes, yeah.
And more energetic, and and you sleep
better sleep.
So isn't that an irony that you're taking something that's doing the opposite of what it's naturally intended to do if you're using the right ingredients?
Yeah.
So let's talk about a moment just about bioidentical hormones, because I think there is a lot of confusion, and you're right. You can customize if you're going to a compounding pharmacy to the patient, which is, one size does not fit all. As a doctor, how do you determine what dosage to give to a patient so that you know that you're doing the right thing by that patient?
Yeah, the easiest patient is the one that comes into me that hasn't never been on hormones, because they're the easiest one. What we do is we put them on the lowest dose and we just adjust it based on their symptoms. And this is where even my very first hormone patient, I remember she was somebody where I was checking her labs, and we use the labs as kind of a reference that we're doing the right thing, but the labs don't always tell you exactly what to do. Like, for example, this was a woman who was in her early 60s. She had no sex drive, hot flashes. She was losing her hair. She was having, vaginal dryness, like everything, you can think of.
All the classic symptoms.
Yeah. And so I started her on a hormone called DHEA, which, interesting enough, is over the counter, but that's just an interesting fact.
Right.
And she was taking it every single day, and I put her on the lowest dose. And I check them in a month later, and now her hair loss got worse. Her sex drive came back, but she was so pissed off at her husband that she didn't want to have sex, and her hot flashes got worse. So we checked the labs, and her testosterone had gone through the roof, her estrogen gone through the roof, and she was on the lowest dose. So then what I figured out over time is we adjusted where she wasn't taking it as frequently, and she came back, and I think we got her down to where she finally was just taking it twice a week, and she was reporting no hot flashes. Her mood was better. Her hair had come back. Her sex drive was back. Everything was good. But then when we checked her labs looked like she was too low. And so this is what I teach practitioners how to do this. This is where I'm like, the labs are just a suggestion of where to go, because even your labs, your normal might look completely different than my normal. And as long as you're feeling okay, you start to track over time, like, okay, well, these are my normal. When I'm in this range, this is how I do. So unfortunately, too often I see practitioners who are not trained well in this. They keep just adjusting based on those laboratory values, and then they never quite get it right, and people's hormones are all over the place. So you got to kind of take like the whole picture into a
I just want you to know that what you're saying is like preaching to the choir. But because last podcast 2 weeks ago, Dr. Amy Horniman,
yes,
but she's the thyroid fixer. She said something very important, and I keep repeating it to everybody. it's the question, how do you feel? It's
Yes.
not what are your labs saying. That's like you said, it's a guide, but it's not the end all and be all. You've got to ask the patient, or the patient has to tell you, how do I feel? And if I start taking something, how do I feel differently than I did before we started this? So that seems to be the guiding parameter for using hormones. So yeah, but you can titrate, up and down, and it also can depend on other things going on with your body, like
Yeah.
microbiome, which we'll talk about in a moment,
Yes.
or your stress levels, or your immune system, and whether or not you're healthy at that time. And you can go from having the flu to being healthy again, and it's going to change your hormonal pathways. So
Exactly.
this is really tricky. I mean, it's almost like you're a detective,
Yes.
you know,
It's a giant puzzle that you're like one piece at a time. Yeah.
and the human body is a giant puzzle because it can be varied depending on all those things we just talked about and others. So, well, I asked you the menopause question, the most challenging part of your practice. So, have you been able to figure out a protocol for menopausal women that you want to share with us?
Yeah, so what I've been able to figure out, and this has also been great because I've been the test subject too, because this is all stuff that I've been through. I was really surprised at how much, and you mentioned it before, the microbiome plays into all this because, people go to their doctors and they're like, I'm having these symptoms like low energy, low sex drive, just give me hormones. And sometimes all the hormones in the world don't fix the problem because we have to go back and take a look at what's happening in our microbiome, which are the bacteria that live on and in our bodies, and even further take a step back and looking at our stress levels. And so, because here's the thing that I found is the pathway by which we process our hormones is the same pathway that we process our stress hormones, except for it chooses like it's either sex or stress, and they can't coexist.
Right.
So when our immune systems were perfect. Our hormone systems were made perfectly in that as cave people, when we were kind of walking across the savannah and maybe we were digesting our food and thinking about going to run off with our honey into the bushes or something like that's all in a nice relaxed state. That's good. Our sex hormones are working, our digestion is working, our immune system is working. But then all of a sudden a lion jumps out of the bush, and this is not the time to be reproducing, digesting, healing, anything. This
Right.
is the time to fight or flight. And
Right.
so when our stress system kicks in, all of our resources go into making stress hormones so that we can overcome that stressor. But then what happens is either we fought off that lion, or we ran away from them, or we stayed so still that the lion like ignored us and walked by. We're then supposed to go back into that relaxed state where everything is functioning again. However, in today's day and age, I say that our stressors, our lions, come in different factors. There are, our inflammatory diets, eating the poor standard American diet. It could be emotional stress. It could be financial stress. It could be toxins in our environment that we're putting on using our cosmetics, and we didn't know that they snuck in there. Their illness. We saw during COVID, during the pandemic, we saw so many people with their hormones that were stabilized for years, and now their hormones went kind of wacky because COVID is a stressor on the system. Even the vaccine, so either one, we were showing it was throwing off people's hormones. So the key to like menopause, and for men andropause, is not just the hormones, but let's look at where the stressor's coming from. Not getting enough sleep is a big one. So, they found that actually getting less than 6 hours of sleep a night actually increases your risk of obesity by 37%. And that goes up to about 53% if you get 5 or less hours of sleep. So, and we know it does throw off the hormones. Not drinking enough fluids, getting enough exercise. So going back to the very basics, which sometimes we think like, oh, those don't really have that big of an impact, but lifestyle has a giant impact on our hormones and our health. And then where I start to geek out a lot is on this microbiome connection. And so, going back to, these are the bacteria that are on our skin, they're in our mouth, they're in our gut, and for women, they're in the vagina. There's a different environment in each one of those areas of our body, and it keeps us in balance and keeps us healthy. I found out the hard way when I entered menopause and I started having problems with anxiety and depression that kind of seemed to come out of nowhere, and was being put on antidepressants that weren't making much of a difference. And then I was also getting sick all the time. And I was seeing all these doctors and nothing was working. And then it was right around that time I started entering the functional and integrative medicine world. And I was studying this, and all of a sudden I went, wait a minute. This all has connection. Like, my immune system and my mood is connected to my microbiome, my gut health. And so this is where I really dove into myself, getting off the inflammatory foods, like cutting down on sugars and processed foods and eating more whole foods. I tell people that the 4 things you should eat are if your food has walked, flown, swam, or grew.
Right.
Like, at some point, that is something you should be eating, because Doritos don't grow on trees. There's no
Right.
free-range Twinkies. So, because why does this connect to the gut? Is because 90% of your happy hormone, serotonin, is made in your gut. And
Right.
if your gut is off, you're more prone to anxiety and depression.
Right.
80% of your immune system is made in the gut. And
Yeah.
so if it's off, you're more likely to get sick. So we do know that there's a very strong gut-brain connection, and stress from the brain can affect the gut. So meditation and relaxation and doing things with friends can help with relaxation. That improves your gut quality and your gut healing. And so then that led me down this also kind of this rabbit hole of looking into the research, and there wasn't much, but now that we're starting to see more, is this connection between the gut microbiome and the vaginal microbiome and sex drive, because the body is very smart. It's smarter than we are sometimes. So if things are off, and let's say we have an overgrowth of bad bacteria in our gut from our poor diet, or we have an overgrowth of bacteria or yeast in our vagina, there's this feedback loop through the vagus nerve, which is one of the main nerves in the body, going back to the brain. And it tells the brain, like, okay, it's not an ideal time to be reproducing. So the brain doesn't know the difference between you just want to have fun with your partner versus you want to actually try to make a child. So it's the brain that processes the whole thing. It's the whole thing. So the brain goes, okay, well, there's inflammation going on in the gut, or the environment in the vagina is not quite right. So let's dampen all processes of reproduction. And so this is now, again, a stressor, and stress and sex can't coexist. So now what ends up happening is we see the hormones get affected. We see sex drive get affected. In our younger people, we see their fertility get affected. And so there is this kind of brain, gut, vagina connection all through these microbes, which is incredibly fascinating to realize how these have such a play on how our health is working on an everyday basis. So
That is such a good explanation. And so recently, the last 2 years, the microbiome has become the hottest topic in all of functional medicine. And now the microbiome, the gut-brain connection is, evolved from that. So explaining it the way you just did is really helpful. And now you've got this other going down south to the vagina, which is something that hasn't really been discussed, like you said. So one question I had is, if someone is having a libido issue and they just don't feel that, either they have dryness or they don't feel like having sex, what are the 2 things that you would right away do for that person, for that patient?
2 things. I don't know if I can narrow it down to 2 things. Well, I think number one, I would look at lifestyle. But if it's a dryness issue, and they're postmenopausal, then we need to start looking at doing things to rejuvenate the vagina, because that's the other thing. Because what happens is when the vagina starts to, or as we age, our vaginal tissue starts to thin out. And when it thins out, we start getting more discomfort with it's not as elastic. It can feel like cut glass. It's dry. It's uncomfortable. And it's not supporting our microbiome because we need that thick tissue when we were younger to basically provide a food source for the healthy bacteria in the vagina. And when it thins out, the healthy bacteria basically starves to death because it lives off of the actively sloughed cells that contain glycogen, which is their food source. So now we got to talk about doing something to rejuvenate the vagina. My favorite happens to be lasers. And why I like lasers is because it uses light energy to penetrate the tissue and it causes like a microscopic injury. And the body responds to that by flooding the tissue with growth factors. So it's almost like a biohacking where it's stimulating the vagina to regrow and collagen and elastin to kind of reform and make it back to the way it was when we were like 20. Why I like lasers is because you can do it without using hormones. However, lasers are not always affordable for everybody and it's not covered by insurance. So there's a whole range of things, anywhere from using topical hormones, whether they're compounded or prescription. Though the prescription ones, there's only one on the market called Imvexy that is not often covered by insurance, but it's the only estrogen ovule that is bioidentical, that's prescription. Otherwise, you have to use the non-bio, or you have to use compounding pharmacies. But even using testosterone in the vaginal tissue can help keep it healthy, or DHEA, which is a precursor hormone to testosterone and estrogen. But, some people get really nervous about using hormones. And, I understand, especially if they've had any kind of issues with the history of cancer. And some doctors are perfectly fine with them using, and I always say check with your doctor first. But that's when in 2014, we had the first vaginal laser that came to the United States. And it was brilliant because we've used lasers for skin since the 1980s. So the fact that they were like, oh, wait, we can apply this to the vagina, like that made so much sense. And that actually then opened the floodgates to the regenerative world, saying, well, what else, if lasers work, what other things that we're doing regeneratively can work down there? And then we saw the development of machines that use radio frequency, which are sound waves to generate heat that will stimulate that tissue to regrow. Using platelet-rich plasma, where they extract your blood and take the growth factors out of your blood and then apply it back into the vagina. And then there's a couple of different over-the-counter products, because then the pandemic happened, and those things that I talked about are usually practitioner administered treatments. So people weren't able to get out to their doctors to, have their vaginas lasered. So there were companies that popped up with home therapies. And so there's a company called Joylux, which makes a product called V-Fit, which is a red light wand. And we know red light, and you see that like some people have these big red light panels that they stand in front of. We know that the frequency of light from red light stimulates our mitochondria, which are the anti-aging kind of powerhouses of our cells. So it stimulates our cells to rejuvenate. So we know that works when you apply it externally, but now we also have wands where that can be applied internally. And even down to, there was a company called CO2 Lift that created a carbon dioxide gel product that can be applied to the tissue. And where that came out of in Europe, something called carboxy therapy is very popular. That's where they inject carbon dioxide into your tissue, and it attracts oxygen and causes rejuvenation and anti-aging in the skin. But the woman who started that company, she was like, I don't want to have needles stuck in my vagina. Is there a better way to do this? And she worked with scientists that created a carbon dioxide gel that can be applied topically to rejuvenate the tissue. So now we have and there's new things coming out every day. So, we have the options from hormones to non-hormones and everything in between. So it's not just like keeping, as we age, it's also keeping the vagina healthy so that it supports the microbiome that then can help our libido, prevent us from getting urinary tract infections, prevent us getting vaginal infections. So it all kind of connects together.
What is the name of the laser that you use in your practice?
So, well, there's a bunch of different companies out there, but the laser that I have is the Mona Lisa Touch, and
Yeah.
that's the first one. But pretty much there's so many different companies that then came out with their own versions, and pretty much a laser's a laser. So, yeah, there's not one that's better than the other.
And is there a downtime when you use the laser, because the skin is being ablated?
Yeah, so typically when someone's getting their vagina lasered, it's usually a 3 treatment protocol where they come in every like 4 to 8 weeks for a total of 3 treatments. If you're just doing inside the vagina, it's usually just a 2 day recovery, meaning no sex or swimming for 2 days. But if we're doing the outside lips too, then usually it's like a week downtime because it's a little more raw.
Mm.
I will tell you, having done it personally myself, and at some point we're going to get the video up on YouTube, not the actual close
Yeah.
up. We filmed it from above when I was getting mine done. Just
Right.
usually during the procedure itself, sometimes you feel a little crampy. Usually for 24 hours, you may feel crampy. It's usually not painful. If the outside of the body is done, we usually use a numbing gel or numbing medicine cream on the outside so that it's comfortable. But then typically like a day or two afterwards, there's not really much discomfort other than the tissue is, kind of raw and you have to keep some sort of balm or salve on it to keep it from getting irritated. Yeah.
It's just like doing it on your face, except
Yeah.
that in the intimate, private area of your body. But it just seemed like it would be so painful to have that area be raw.
It's surprisingly you heal very, very quickly down there. And the thought behind that is a lot of people rip and tear during childbirth. And so we're kind of built to like quickly heal down there to be able
Yeah,
to overcome those things.
that's a good point. So what about the um, candida and UTIs? How do you deal with those, and what's the protocol that you think is best to not only, let's talk preventatively and then talk post, treatment wise, and when you already have the conditions.
Yeah, so, first of all, if you're postmenopausal, or if you're on birth control, or if you're pregnant and breastfeeding, not much you can do to rejuvenate the vagina, but people on birth control and people that are postmenopausal are at higher risk because of that thinning. So number one, we have to do something to kind of thicken the vaginal tissue so that it supports the healthy microbiome. But then we have to look at where is that bacteria coming from? And unfortunately, as women, our rectum, our vagina, and our urethra, the tube we pee through, are very close. And it's not necessarily, some people will think it's a hygiene issue. It's no matter how clean you are, it's just have a tendency to be able to pass bacteria back and forth. Of course, we always tell people wipe front to back, and the reason is you want to wipe away from the buttocks area, the anal area, because you don't want to bring that bacteria closer to you. I tell people, some people are like, I can't do that. I tell them just
Yeah,
pat dry in that area.
right.
But then the other thing is we're looking at the pH of the vagina is often getting thrown off, and that's a chicken or the egg thing. Is it off because there is bad bacteria there, or is the bad bacteria coming in there because the pH is off? So actually, one of the ways to treat vaginitis without medication is actually to make the vagina more acidic. So using products like boric acid, or there's some suppositories that are made for women that actually have vitamin C, which is a little bit acidic, and that helps to kind of reset the vagina. I love boric acid, especially in the summertime. If someone's going to be in a wet bathing suit all day, I'll have someone kind of throw one in preventatively. I find that if I have patients that are getting recurrent urinary tract infections, especially after intercourse, I will often have them use a boric acid suppository after intercourse to kind of reset that pH. But the other thing is when I see women that are coming with recurrent urinary tract infections and recurrent vaginal infections, then I have to take a step back and go and look at the gut, because we see that a lot of times it's their gut microbiome that's gotten thrown off, especially with yeast, because diets that are high in sugar will have you overgrow yeast in the gut, and it just happens to kind of get into the vagina. And so we can treat the vagina all you want with like Monistat and creams and stuff. And this is where we see people where they're doing really well and they get it itching or burning, and then they use a medicine, they get better, and then like 2-3 weeks down the road it comes back again. Or this is sometimes a pattern I'll see with urinary tract infections where it's like they go on like the 3 to 5 days of antibiotics and then they're good. And then 2-3 weeks down the road, it comes back, and they keep going through this pattern where it's back again. And so that ends up having, a source in the gut. And then we have to really go and evaluate what's happening with the gut and trying to get that back on track. Now, I like to use like fancy tests where we do what's called stool microbiome testing, where I can exactly pinpoint what's happening in the gut and then target the treatment. But things that people can do on their own without having to do the fancy tests is really get on a whole foods diet, try to get away from the sugars. And yeast is an interesting thing because the presence of yeast in the gut, they found that some of these microbes actually have DNA that can control the human body. So when yeast is present, it actually tends to give you sugar cravings. And it's because the yeast wants to be fed, so it likes to live off of sugar. So sometimes if I have somebody that's getting a lot of sugar cravings, I'm like, you know what? This is where you got to take control, and you have to feed yourself, not the yeast, and try to ignore those cravings. Eventually they'll go away. But eating whole foods, like I said before, fiber, everybody hears that fiber is good for you. No one ever asks, well, why is fiber good for me? The reason why we need to be getting 25 to 30 grams at least of fiber a day in the form of fruits and vegetables, more so vegetables, is because that's what the healthy bacteria lives on. The healthy bacteria lives on fiber. So if we're not eating enough fiber, we know Americans don't, we're not supporting the healthy bacteria that's then going to fight off the yeast and the bad bacteria. And the other thing is getting more fermented foods in our diet. And luckily now most of us can go to the supermarket and find them very easily. But if you're really motivated, you can make them your own. But there's yogurt, kefir, kombucha, which is fermented tea, sauerkrauts, kimchi. Eating some sort of fermented food every single day can actually make a big change. Like I had a friend of mine who was having all these gastrointestinal issues, and I'm going to throw him under the boat right here. And I said, like, let me test your gut microbiome. And he just never got around to it. But he started drinking something called kvass, which is like fermented beet juice. And he swears to God it's the kvass that like cured him. And I'm like, no, and he got much better, and thank goodness he did. I said, yes, it is the kvass, but it's not just the kvass. It's the fact that you added fermented foods into your diet, and now you basically repopulated your body with healthy bacteria, so now the body's going to work better. So, yeah.
Well, I tell my viewers all the time that if you look in your refrigerator, make sure that you have those exact products: sauerkraut, yogurt that's unsweetened, and
Yes.
you can even buy lactose-free yogurt now. They make coconut if you don't want to use milk, but definitely do not do sugar. I mean, don't do a fruit yogurt. And then kefir and kombucha, kimchi. I have a hard time with because it's very spicy, and well with garlic. So I never mention. I always tell people, if you like that, go for kimchi because that's actually one of the better ones. And then, of course, using things like garlic and the foods that are going to help to eliminate the bad guys.
Yeah.
So, and then if you can do anything with avoiding antibiotics, that's like when you said that earlier, I thought, the problem with these yeast infections and these vaginal, that they always, the first thing they want to do is give you an antibiotic.
And that's what I see all the time with these urinary tract infections too. And like the practitioners often reach for Cipro, which drives me crazy because one course of Cipro can throw off your gut for a whole year.
It's like an atomic bomb.
Yeah, and so and then that's why then you end up just getting more infections because now you've affected your immune system. So it's like, I mean, there's a role in place for antibiotics. We need them, but we probably don't need them as much as we're using. And I think in
Yeah.
general, we're seeing that people are trying not to use them as much. But if you're on that cycle of getting these infections and then getting better and then getting infected, the antibiotics could be contributing to throwing off that microbiome that's making you then get these infections more often.
And yet that's what they prescribe for the very infection that the antibiotics could be causing or at least making worse. So
Yeah.
what about the O shot that people talk about? Have you ever done that? And what do you think of it?
Yeah, so some of it I think is a little bit of placebo, but some of it. So the O shot in actually that specific name is actually a licensable name, but it's many places do it. It's using platelet-rich plasma and using the growth factors from your blood to inject. They inject it typically in the anterior wall of the vagina to
Mm-hmm.
kind of bulk up that area between the vagina and the urinary system, the bladder and the urethra, and they also inject in and around the clitoris. And so the nice thing is it does have regenerative properties. I think in some ways there's a placebo effect, meaning that people get it thinking like this is going to like make their sex life so
Yes.
much better and like this is the answer. It works, but it works because it's rejuvenating and making that tissue young and functional again.
Mm-hmm.
So it's really just kind of stimulating your own body to kind of heal itself. But and and I don't want to bust on placebo because hey, placebo, if it works, it works, you know? So, but is it a miraculous cure-all for sex life? It's another tool in our toolbox. It's not, yeah, it's not this like,
You
okay,
know,
this is gonna fix everything.
the other day I was reading an article and it said never ever douche. And when I was growing up, that was what they told us to do, and to basically keep yourself clean. So what happened? Why is douching not recommended now in the current day? And historically, it's always been a protocol.
Yeah, so well, number one, it'll throw off the microbiome because you're like washing away a lot of the good bacteria that are in there. The other thing that they get concerned about is for women who've never had any kind of surgery down there, like a hysterectomy or anything, we're an open system, meaning that the vagina is kind of connected to the cervix, which is the opening of the uterus, and there's just a cavity in there. And then beyond that, the fallopian tubes are open into the abdominal cavity. So there is the risk that if you douche and you put too much pressure on the fluid could go from the vagina through the uterus, out the fallopian tubes into your abdominal cavity. So you could be washing bad bacteria and yeast into your abdominal cavity, and that is not a good infection to have. So
Right.
that's pretty serious. So, do I use them on patients medically in certain situations? I do, and we either instruct them to do it very gently, but in the right, and I would not tell people to do this at home just because, but in a medical situation, sometimes we'll use like a watered down peroxide, because peroxide is actually naturally found in the vagina when healthy bacteria is there. Healthy bacteria will make peroxide. So sometimes we'll use a very light, like peroxide, or even vinegar is
Yeah,
not
that's what I thought.
terrible,
Or
but
baking soda or vinegar is what I've always heard.
yeah, the baking soda not so much because the vagina is very acidic. The vagina has so like the pH of water is 7, where the pH of a normal vagina is 3.5 to 4.5.
Oh,
It's very acidic. And
oh,
so baking soda would make it would lower the acidity, which I still have not figured out. Most things in nature, I kind of understand why they work. The only thing I have not figured out is semen is very basic. It's 7 to 8 on the pH scale, and that's why some women have problems if they're having sex with men. They get and they can have their pH of their vagina thrown off if they have semen inside of them. It makes their pH, which is supposed to be acidic, and it throws them off and can sometimes increase their risk of infections.
is that why they tell you to always try to urinate right after you've had intimacy? That because you're trying to get rid of that semen that could be damaging.
Yes, well, that's more so from the friction of any kind of sexual intercourse because the vagina and the urethra are so close together that sometimes bacteria from friction can get pushed up into the urethra, the tube you pee through. So the idea is by peeing after intercourse, we're flushing out the urinary system and the urethra to try
Mm,
to not get a urinary tract infection. Yeah.
okay. So tell us about the pelvic store. That's your baby.
Yeah, yeah. So the pelvic floor store dot or
Pelvic.
pelvicfloorstore.com.
Yeah.
Yeah, that is my baby. So I was recommending products to patients and I would say, okay, go to this website and buy this, go to that website and buy that, because a lot of these health products that are reputable are not sold on Amazon. And the other thing I have to tell you about Amazon is we know that they're counterfeits. So I tell people, don't buy your supplements, don't buy your health products off of Amazon because you don't know if you're getting the right thing.
Exactly.
Okay, beyond that, so my one day I had a patient that said to me, like, why do I have to go to so many different websites? Why can't there just be one where I could just go get everything? And I went, little light bulb above my head. I'm like, wait a minute, that's brilliant. I don't know how to make a website, but I'm going to make a website. So I made a website, the Pelvic Floor Store, and I basically put all the products that I recommend or products that I find that I think are good in one place.
And
So
you had to go and source all those products, though, right? So this was a major effort on your part to get.
yeah.
You have to have those products in your inventory, and then you have to deal with all the shipping and the processing of the financial side. So this is not like some simple. You make it sound so easy, like it was just an idea, and all of a sudden the next day it was.
Well, I think we started off with like three products and then we keep adding them because I keep finding things. And then I think the most painful thing is when I've had to let products go. Like I have a product line that I believe in, but it just isn't selling and I'm gonna have to let it go. And I'm like, ooh. So
Uh,
that's gonna be the
what?
hardest.
How do you think a product wouldn't sell, Betsy? What's your theory on that?
I think that sometimes like this is a I don't want to badmouth the product. So it's a prebiotic gel for the vagina. So it's basically to help feed the healthy bacteria. I and as a doctor, I think that's great. I think from the complaints I've gotten from patients is like they put it in and then it melts and becomes very drippy.
Oh,
So I think people are like, it's drippy, it's uncomfortable, and I
right.
think that that ends up being, and they don't necessarily see maybe the benefits from it as quickly as they see from like a boric acid or a vaginal probiotic. So I'm like, all right, maybe it's time to let that one go. So.
Well, is there a lot of our guests like to offer the viewers or the listeners an incentive? Is there anything that you feel you would like to suggest and to basically it's to encourage them to know more about you and what you're doing and your products. So I don't want to put you on the spot because if you're not comfortable with it, it's okay. But if there is anything, we have a Michelle recommends on our.
Yeah.
So we put your name, the web podcast date, and your offer, and then they use the ageless code, so you know that you're getting referrals that are going to have whatever your offer is. So if you want to do that, well, I'm happy to mention it here. If not, we can do it later. It's up to you.
Yeah, and in fact, actually, I am just looking and I do have a code. Two, I have a code here. It's ageless 10.
Oh,
So if you go
fine.
to yeah, if you go to the pelvic floor store
Yeah,
and you use code ageless 10, I'm
yeah.
just going to make sure when we get off this that it's working. That will get you 10% off
Perfect.
anything and everything, whether you want to buy one thing or a bunch of things.
That,
So that will get you 10% off your entire order.
and tell us the website again for the pelvic floor
Pelvicfloorstore.com.
.com. That's pretty easy.
Yeah.
Okay, pelvic. I'm writing this down, but it'll be on the tape here anyway. But I'll have my assistant make sure that this goes on our website for you. Okay,
Yeah.
run out of time, and I knew this would happen. When you're talking to someone who's as exciting and fascinating as you, and you have so much knowledge, it's just fun to brainstorm with you. If you, in our parting message, what would you like to share with our viewers today?
Yeah, I think that the biggest secret to, first of all, being ageless and timeless is going back to simple things like lifestyle. And total wellness is like a three-legged stool. You can do everything you want to the body, but if you're not taking care of mind and spirit, additionally, that three-legged stool is going to fall over. So it's going to be a balance of all three to like live your best and vital life.
Yeah. That's lovely. Thank you so much, Betsy. Well, I hope you have a wonderful weekend, and thank you again for taking time for us today and for ageless and timeless viewers. I'm sure they're going to be very appreciative. We will do a couple of reels on Instagram and Facebook, probably. So we asking you to collaborate if you don't mind, and then
Yeah, definitely.
we'll do the opposite for you if you want to take any part of our podcast or the whole thing. Do you have a social media presence?
Yes, I do. I do. I'm Dr. Betsy Greenleaf in many different shapes and sizes all over
Yeah.
the internet, and I just finally got my regular Dr. Betsy Greenleaf back. I got kicked off of Instagram,
Oh,
talking about vaginas a couple years ago.
wow. Well,
So
today with Robert F. Kennedy, I think is going to be a lot different.
yeah, yeah,
Um, yeah, I have a YouTube channel as well. Are you on YouTube?
yeah, yeah.
Okay, very good.
Perfect.
All right, we'll do a bunch of mutual reciprocal collaborations. So thank you again, Betsy. Have a great weekend, and be well, and stay as positive and upbeat as you are.
Thank you. Thank you so much. I appreciate it.